Hello friends, it seems like we've got a lot to catch up on. It feels like we do. Yeah, it's been a big week for me. I did pop one little video up of when I was in hospital. I think that was when I'd first got there, the first day before anything really happened. So where do I start? Let me start from last Tuesday when I went to my doctor to get the results. I had CT scan done, I had blood test done, and they did an ultrasound on the breast as well. And everything looked pretty good in the CT scan, actually. It's, yeah, the breast tumour was pretty much the same. When I read through the report from the CT scan, pretty much everything's saying stable, hasn't changed. Everything's pretty stable, hasn't changed. There was a little bit more going on in the liver, but nothing fantastic. The liver tumour had got slightly bigger, like 5 millimetres. So the American people, that's not very much, very little. So that's grown a little bit. There's a little bit more action in the liver there, but nothing outstanding, or nothing in big black letters that new or anything like that. So yeah, but the one thing that did come up in the CT scan was the pleural effusions. That is the liquid that surrounds my lungs. Like, we all have liquid around our lungs, but so that our lungs can move. But mine, I've got them in both sides, but the left side's just stayed there, just small. But the right side decided to start growing up. Now, I was aware in Bali when I was there in March that I just didn't feel like I was breathing. I just couldn't get that full breath. My breath didn't feel like it normally should, so I think that's when it was building up. So I'm going to pop in a couple of things from the CT scan here. I'll pop in, this is my the right lung. So viewed from the right side, you can, these are also taken while I'm laying on my back, by the way. So the right lung, that's what it's meant to look like. It pretty much goes, you can see it goes right back to the spine. Now when we go the other way to the left lung, and there's that shaded area, that shaded area is the fluid. That's the fluid buildup. So it's shortening the amount of area I've got to breathe in there. And it makes a big difference. It made a big difference. So that's a left lung, that's me laying on the back. I can just pop one more image in there, and this is just kind of like straight down the middle as it goes up. So straight down the middle of my lungs, you can see the thickness of that compared to the one on the right, on the left side. So the left side's still really clear. We're not worried about that. Hopefully that's going to just stay the way it is. So I went in, and the next day they came and did an ultrasound, and they said, yeah, there's a lot of fluid there, and it's been there a while. Looks like it's been there a while. It's old fluid, and there's a lot of proteins in it, which Bill said means acid. I'm not really sure on that one, but they said there's a lot of proteins in it. I think those are things I want to get rid of anyway. And that they needed to drain it, which sounded really scary to me, because I know I saw a friend get that done. They stick a tube in your back. It looked scary, but so they were going to drain that later in the day. That day, hospital was very busy. There was blood tests and scans on this and that and the other thing. So they came around, I think it was about 3 o'clock that afternoon, to do the drain. Now, what they got out, they couldn't take it all out. They said there's a few litres in there, but they were going to try and drain off a litre. If they take it too fast, or anything can happen, your lung can collapse, you can go into shock. So they take a litre at a time. Or there's other methods. They do have a slow drain. You can go on for all day and they'll get it all out. But they wanted to just do this litre one, then analyse that to see if it's cancer or not. And you know, it probably is, because you don't really get pleural effusions from anything else unless you've got, well, you can, but I don't have any of the other things that cause it. So they're going to analyse that, and then I go back on Monday and find out. Anyway, I thought I could give you a little picture of the bit that they did take out. They took out this and a little bit more that they took for their testing, another 100 and something mils they took for their testing. And as you can see, it's quite dark. And I'm thinking all that darkness in there is probably yucky toxins that need to come out of my body. That doesn't look right. It looks like your urine when you're not well, you know. So I've still got some of that in there sitting around, about that much again at least, sitting around this right lung. And next week, well, tomorrow I should know what their plan is to get rid of the rest of it. And it needs, they say that pleural effusions just keep coming back when it's due to cancer. So we'll have to see what the long-term plan is on it, how we're going to deal with that. But for right now, we'll just deal with it one day at a time. I also got the results of my blood tests last week. I've written some of them down. So basically, overall, everything's still really good. My inflammation did go up a little bit, but it just says slightly raised. Nothing that they're worrying about. It's not like it's really bad or anything. And but the tumour markers, and I wrote down, so I've had my bloods done February, March and April. So in February, my tumour marker, CA125, that was 255. It's meant to be less than 36. So yeah, that was expected, 255 with active cancer. And then when I went to Bali, in March, my tumour marker, the CA125, was 350. So during the water fast, it kind of went right up there, and they did say expect it, that's kind of expect it, and I told you guys that. And then in April, the ones I've just done, it's CA125 is 239. So they were 255 before in February, and now they're 239. So that's showing really good improvement, and it means if you look up the tumour markers, that's what they use to find out if their treatments are working, like if their chemo is working. If the tumour markers come down, they say, oh, the treatment's working. So I'm like, yeah, my treatment's working. And we've got the CA153, which is a more specific one for breast and ovarian cancer. In February, it was 276. And when I went to Bali, it went up to 358 in March. And in April, it's now 327. So it's come down since March, but it still hasn't come down to the level it was in February. So we'll still keep working on that. There's another one called CA. Not exactly sure what that meant, but it's a tumour marker too. It was 9.2 in February. It went up to 12 in March. And now it's back down to 9.6. So they're all showing the downward trend. Yay! And as I talked to my coach Bill on the phone, he says, hey, Cindy, you got to remember too, this is only early days. I haven't even been back from Bali a month yet, so it's been less than 2 months in total since I've been doing my treatment full on, which include the water fasting and the raw food and all, the way I'm treating my body now. And also remembering I've got years and years and years of probably starved and bad eating and bad habits and the sugar and processed food and Burger King and who knows what I've eaten over the years, I haven't been real good that way. I've eaten a lot of good things, but I've also eaten a lot of junk, So yeah, my body's just going to take a while. Doesn't happen overnight. So I was pretty happy. I was pretty happy with the blood test. Not everything's perfect in it, but they're all, everything's going really well. Everything's going really well. So just wanted to share that with you guys. That we're having some positive results, despite the fact that we have this little hiccup with the pleural effusion, and hopefully we can get over that. As I told you in hospital, I told you in the last video, but maybe everybody didn't see that. but my oncology doctor came in the night that I got there, and she was pressuring me to take those horrible drugs again. And she was saying things like, oh, why are you doing this? You've got a beautiful daughter who cares about you, and you've only got months to live, and, going on and on. And then she got me to do all these tests, and then she reckons she thinks I have brain cancer, that it's gone to my brain. So she ordered a brain scan for me. And then later that night, the brain scan was the next day. Later that night, they come in with steroids, trying to give me steroids for my brain cancer, which, forget that. Oh, you got to be careful in the hospitals, I tell you. They try and slip you these things. Anyway, they did do the brain scan the next day. I let them do it, and all these things are invasive, and they're radiation. Anyway, I let them do it, and it's totally clear. There is no sign of any cancer in my brain, so I can still think. I can't blame it on cancer brain now. Yeah, so I didn't think that it was. So I'm happy about that. That's one thing I don't have to worry about dealing with. Basically everything's going really well. My brother's coming next week. I'm so excited. My brother's coming from America. He's going to be here till the 19th. And then on the 19th, I'm meant to go back to Bali. So there's so much going on in my life right now. Well, I'm just glad I'm not sitting here on this couch feeling sorry for myself, taking those horrible drugs they wanted to give me. And then when I came home yesterday from the hospital, some of my church friends, some of the brethren had come around with my daughter and totally cleaned my backyard for me. So I've got a nice place. Look at that. Just a nice place to come out now, sit down. It was a total mess. It was a total mess. Hadn't been done in a while. So yeah, there's just a nice place for me to sit. There's my Agony stuff up there. And I'm pretty happy about that. It's my Bali mirror. Yeah, so I was really happy about all that, really grateful for them. I'm just surrounded by so many beautiful people in my life that are there with their love and their prayers and their support for me. I couldn't, I don't know, I'm just so grateful. Everything's so good. All right, so we'll see. We've got the appointment on Monday. We'll see what happens and what they're going to do, and we'll do an update in a week's time or so. Okay, namaste.